The following program presents principles designed to promote good health and is not intended to take the place of personalized professional care. The opinions and ideas expressed are those of the speaker. Viewers are encouraged to draw their own conclusions about the information presented.
Hello and welcome to Health for a Lifetime. I'm Don McIntosh, your host, and today we're joined with Dr. Kevin Bryant from Wichita, Kansas. He's a specialist in family practice and focuses on helping the older adult or geriatric concerns. And one of his special things that he likes to study are natural remedies for many different concerns, and also with those who are getting older. Isn't that right, Doctor?
That's right. Since my area of practice is for the elderly in geriatric population, looking at something in the area of natural remedies has always been an interest of mine.
Now, natural remedies, when we talk about natural remedies, some people probably get a little frightened. That sounds alternative, sounds kind of, you know, maybe on the fringe. You are a medical doctor, correct?
That's correct. And we do want to say right up at the beginning that any of the things we're going to be talking about, if someone listening says that sounds like something I'd like to look into further, it's important that they do talk to their physician, because some of the herbal preparations that we're going to be talking about may interfere or interact with medications they're on, and they need to be sure that their physician is aware of that.
You literally see hundreds of patients a year, isn't that right? You have many nursing homes and many patients you see.
Right.
And many of them are on medications, but what's the difference between a pharmaceutical or a medication that's made in a and then sold in a pharmacy, and a natural remedy?
Well, one thing that has been interesting to me as I've looked at this area is looking at the difference the way plants produce chemicals and the way they're produced in a chemistry lab. When they're produced in a chemistry lab, the chemical compounds that are made there, the drugs, the pharmaceutical agents, have what we call left and right hand forms. They're like our hands, and they can't be superimposed on each other, but they're mirror images.
So in any given drug, there's a right hand, there's a left hand.
Right, left and right hand form of that drug.
Form of that drug. So you got a right-handed aspirin and you got a left-handed aspirin, or whatever.
Now the importance of that is that our bodies only interact with the left-hand form. And so pharmaceuticals produced in the lab produce a mixture, 50-50 mixture of left and right hand. So half of the drug is not interacting with the body and producing the effect that it's designed to produce. So only the left hand.
So what, I mean, to use a simple, you got this pill, only half of it's working is what you're saying. And what's the other half do then?
The left hand form is the one that's actually active and producing the effect that the drug is designed to do. In the plant kingdom, when plants produce compounds that are effective in our body, they only produce the left-hand side, 100%. Some people think that may have something to do with a difference that we see in the amount of side effects that are evident. You only have to pick up a physician desk reference, which is the manual that goes over all the pharmaceutical drugs, and look through the section on adverse reactions or side effects to realize...
most of the book, isn't it?
Exactly, that they do cause side effects.
So that pill, whatever it is we take from the pharmacy, half of it really works. The other half, we're not sure what it's doing. But it's that right hand versus left hand. That doesn't mean you're saying to people, do away with your medicines or stop them or anything like that. No.
It's just kind of a way of thinking.
Understanding it.
Understanding why it is that the herbal preparations, by and large, seem to have a less number of side effects.
What are some of the things you're going to talk to us about today? You know, we're going to talk about some of these natural remedies. What are some of the things you're going to be covering?
Well, we want to look at some of the concerns that our geriatric population are facing. And we've talked about the difference between pharmaceutical agents and herbal preparations. We want to spend a few minutes looking at some natural remedies for ophthalmology or eye concerns. Many of the elderly population are facing cataracts or blindness due to macular degeneration. We're going to spend a little bit of time on prostate problems, and then something that many of the older population fear is the diagnosis of Alzheimer's disease. What can we do to maybe prevent or treat it with natural remedies? And then lastly, focus on osteoporosis.
Sounds very interesting. I know my grandfather lived with me the last 3.5 years of his life. I was able to, had the privilege of taking care of him, and he did have problems with cataracts and whatnot. What can you tell us about natural remedies for cataracts? And the other big word I think you used was
macular degeneration.
Yeah.
Right. Let's talk about cataracts first.
Okay.
Some researchers in Baltimore did some interesting studies on a geriatric population where they did something simple as looking at the amount of fruits and vegetables that were in their diet. And then they followed them to see how many of them developed cataracts. And what they found was that if they divided the group into two groups, one group eating 3.5 or more servings a day of fruits and vegetables versus the group that ate less than 3.5 servings of fruit and vegetables a day, the difference between those two groups in developing cataracts was incredible. In fact, the group that ate less than 3.5 servings a day had 13 times the risk of developing cataracts. So development of cataracts is not necessarily just something that's in a person's fate. Something as simple as eating more than 3.5 servings of fruit and vegetable a day can help reduce that risk.
So if you don't have cataracts and you're watching today, hey, start eating those fruits and vegetables and you're going to avoid those.
Right.
Oh, that's good news. I mean, I thought you were going to say that it was helpful, but I didn't know it was that helpful.
Well, that was a phenomenal finding in that study. Now, the other aspect they looked at was macular degeneration.
Which means, what does that mean?
That's a deterioration of the retina. And they found, again...
Just a minute. What is the retina? What does the retina do? Okay, the light comes in the eye and then...
And is focused on the back of the eye. So these are the cells on the back of the eye that the light is focused on. And the area that's most important is called the macula.
The macula is part of the retina where the light focuses on. Okay.
Right. And deterioration of that area causes a considerable amount of the blindness in America. They found a similar type of thing where those that were low in the fruits and vegetables
saw more,
had twice the rate of this disease process occurring.
So fruits and vegetables, was Mother right? Eat your carrots?
They do help. They really do.
So maybe if you're watching, you want to go and get a carrot, that would be great. Let's go on and ask what kind of things can help in these other areas you mentioned. I think the other one you mentioned was prostate.
Yeah, for men, by the age of 75 in America today, 50% of men are having problems with their prostate. And one of the newest herbal preparations that is finding some real help in this area is one called saw palmetto.
Saw palmetto.
As the name might indicate, it's taken from an extract from the berry of a palm tree. And they found that in various studies where they compare it against a drug, a pharmaceutical agent called Proscar, the studies looking at those two, comparing them, we find that it's just as effective. Just as effective, but less side effects, although it does have some small amount of side effects with headaches, nausea, dizziness. One other thing we have to mention about this, it does affect what we call PSA level.
What's that? What's a fancy name for?
Prostatic assay, which is measuring for the possibility of prostate cancer.
Okay. So if you take this, it could mask a problem?
It can mask a problem, right. So that's, again, coming back to the reason why it's important to let your physician know if you are taking some of these herbal medications, because the effect they can have on lab tests. And it's also important to mention here, saw palmetto is really only to be used for prostate enlargement problems. It's not really useful for prostate cancer.
Okay, so, all right. Many of these things you can get over the counter in a health food store or some place. How do you know whether or not you're getting a good source of you know?
Okay, and that's
palmetto?
an important point. The in Europe, herbal medications are used extensively. In Germany, 90% of the prescriptions written by physicians are for herbal medications.
Is that right? 90%?
90%
of medical doctors?
Of medical doctors in Germany are writing for herbal preparations, and so they've developed a much better regulatory system for making sure that it's standardized and quality control. We don't have that yet here in America, and so there is some concern that some preparations may not be as quality control. One important helpful point on that is if on the bottle, and you're looking at the active ingredient portion, if it says standardized in the dosage area, that this is standardized, then that is indicating that they've had some quality control and that you can be a little more sure that that's the amount that's in there.
Another question about that over-the-counter business. I mean, you find out it's standardized and whatnot, but really what you're saying is you could help yourself, but you could also endanger yourself if you're not communicating with your physician.
Correct. Yeah.
Okay. Well, we've talked about saw palmetto for prostate. We've talked about fruits and vegetables for cataracts and for macular degeneration, if I said that right. We've been talking with Dr. Kevin Bryant. He's a specialist in family practice from Wichita, Kansas. He has a real interest in using natural remedies for the things that affect older Americans. And we hope that if you join us, you'll come back and listen after the break. We're going to be talking about some other fascinating discoveries and things that we think can be of help to you and perhaps your physician as you work together. And we hope that you join us.
Have you found yourself wishing that you could shed a few pounds? Have you been on a diet for most of your life, but not found anything that will really keep the weight off? If you've answered yes to any of these questions, then we have a solution for you that works. Dr. Hans Diehl and Dr. Eileen Ludington have written a marvelous booklet called Reversing Obesity Naturally, and we'd like to send it to you free of charge. Here's a medically sound approach successfully used by thousands who are able to eat more and lose weight permanently without feeling guilty or hungry through lifestyle medicine. Dr. Diehl and Dr. Ludington have been featured on 3ABM, and in this booklet, they present a sensible approach to eating, nutrition, and lifestyle changes that can help you prevent heart disease, diabetes, and even cancer. Call or write today for your free copy of Reversing Obesity Naturally, and you could be on your way to a healthier, happier you. It's absolutely free of charge, so call or write today.
Welcome back. We've been talking with Dr. Kevin Bryant from Wichita, Kansas. He's a specialist in family practice, and he focuses especially on the older adult and different health concerns. And he's not telling you to go away from your normal doctor in any way, but to work with your doctor and to look at some natural remedies that can address some of the problems that older Americans deal with. Doctor, we've talked about cataracts. We found out that if someone eats fruits and vegetables, they can decrease their risk of having a cataract by 13%. You've talked to us about macular, or 13 times
yeah.
That's amazing. And then we've talked about macular degeneration. If you eat those same fruits and vegetables, it's 2 times.
Two times, right.
And then we also talked about prostate enlargement, not prostate cancer, but enlargement, and we found out this herb called
saw palmetto.
Saw palmetto can help us not have that enlargement and all the problems that come with us. But
right.
You also said, hey, be careful. It can throw off your PSA test, and those of you that have experienced or know someone that's had prostate cancer know what that's all about. We've come back now. We're going to talk a little bit about another problem that many older Americans face, and that's Alzheimer's. What is Alzheimer's, just to give us an idea of what it is, and then what can you do to help us from a natural remedy standpoint?
Okay, some interesting things here. And Alzheimer's disease, simply put, is a brain degenerative disease that affects one's memory and ability to make judgments and process information. For many elderly in this country, they would almost rather hear the word cancer than Alzheimer's disease.
I think most people, that's
yeah.
true. Mm-hmm.
And so a couple things that we want to look at that are very interesting in the area of natural remedies. And in this area of Alzheimer's disease, there's mounting evidence that what we call free radicals are causing some of the damage to the brain cells, leading to this disease we call Alzheimer's disease.
So just a minute before you go, you finish with that. When you say free radical, I mean that sounds like some weird person running around. But does that mean what does that mean exactly? A free radical?
Well, in our body's metabolism, energy metabolism, sometimes oxygen is metabolized into free radicals, and our bodies generally, for the most part, are able to correct any of the damage that occurs from free radicals.
And a free radical, what does it do? Just bounce off everything and injure things? Is that what you're
right?
Meaning?
It's almost like a loose cannon firing away in our cells.
I didn't mean to get you off your point, but what you were saying, I believe, was Alzheimer's. They theorize that these molecules that are banging off everything can lead to actually Alzheimer's. Okay, go ahead. What next?
So one of the herbal preparations is ginkgo biloba. Now this comes to us from China, the Orient, Japan, and in fact it's from a sacred tree in China and Japan. It's been used medicinally there for centuries, and the extract is actually a free radical scavenger.
Looks for the bad guys, looks for those people that are bouncing off the
and
wall.
neutralizes them.
Those molecules, okay.
Now, there's some interesting studies that have been done in the recent years in the Archives of Neurology. They reviewed all of these studies, and they found 4 studies that met strict scientific criteria that they could use. And they found that using 120 to 240 milligrams a day of ginkgo showed a very significant effect over a 3 to 6 month treatment period of actually improving the person or slowing the progression of the disease. Another research journal called Brain Research, I found this very interesting. They reported in March of 1996 these researchers were taking nerve cells and exposing them to hydrogen peroxide, which is a very strong free radical producer.
All that fizziness.
causes
Hey, that's a good way to describe free radicals, isn't it? If you've had hydrogen peroxide and you know what it does, that's a free radical.
And to put and exposing normal nerve cells to that
okay.
causes a significant amount of damage. When they pre-treated with ginkgo those nerve cells and then exposed them to the hydrogen peroxide, they found a marked decrease in the damage that the hydrogen peroxide was causing. Another indication that the ginkgo was protecting nerve cells from that damage by these free radicals.
And again, this ginkgo, I mean, you said it in the first section of our program today. Maybe some people have just joined us. This needs to be that standardized ginkgo. In other words, you know, the type that's really good.
Finding
look for it to say standardized.
Right, finding the best brand out there that you can.
Another thing I think that maybe I don't want people to miss, but I heard it. You did a lot of research on this, and you didn't just look at any study that was off the wall. You said, hey, there's this group that looked at all and looked for those really scientifically well-researched claims.
Exactly.
Okay.
Right.
What other good news do you have for us concerning Alzheimer's?
Well, back to something we've talked in previous programs is vitamins, the vitamin C and vitamin E. They're vitamins that we know have antioxidant effects. They're powerful antioxidants, and they've looked at the Rush University in Chicago, studied a group of patients, 633, and they found that those that were using vitamin E supplements and vitamin C supplements had a marked reduction in the number of Alzheimer's, dementia, or disease development among those patients.
So in other words, they gave them these things. They thought they were going to develop Alzheimer's, and then they didn't because they got these things.
It seemed to protect these users.
When you say a market, I mean what? They studied 20 and only what happened?
Well, in a group of 27 that were using vitamin C, none of them developed it, as where it had been predicted. They used models to predict how many they would expect to develop the disease. They were expecting approximately 4 to develop it out of 27, but none developed it during the study. So their conclusion was that vitamin C and E appears to be able to lower the risk of development of Alzheimer's disease. Another researcher called Dr. Sano looked at vitamin E in a study where they were looking at patients that already had Alzheimer's disease, were in the early stages, and they were wanting to look to see if they could slow the progression of the disease down. And what they found that was using 400 international units a day of vitamin E slowed the progress of the disease by nearly 2/3. Now you might say
that's
2/3 of a year,
but that's still probably
it was a significant difference between that and a placebo pill.
Dummy pill, than sugar pill or something.
Right.
So in other words, what you're saying with that is any time is valuable time if someone is losing their ability to remember something.
Right, because the things they were looking at was the progression of the disease was someone that could do all of their activities of daily living now lose that ability or have to be moved into a nursing home. So these were looking at significant events in the progress of the disease, and those things were pushed off down in the road.
One question for you. When you talk about vitamin C and vitamin E, does this mean the actual supplements in this case? It sounds like you're talking about taking supplements in this case, or is it fruits again? What are you talking about?
Well, in this study, they study the supplement itself, vitamin E, 400 international units.
Well, let's move on. We have one other thing you wanted to talk to us about, and you've dealt with several different things here, but another big thing is brittle bones, osteoporosis.
Osteoporosis, and we'll just focus briefly on that. And the first concept to recognize with osteoporosis, brittle bones, is that our bones are like calcium banks. And from birth until about the age of, in the 30s, we're putting calcium into our bones. 99% of the calcium in our body, it resides in our bones. 1% is dissolved in the bloodstream.
So they just keep packing it away till you're in your 30s.
Right. At that point, it's a process of withdrawing calcium from those bones. And in America, we withdraw too much, and by the time someone's in their 50s, 60s, and 70s, the calcium has been withdrawn from the bones too rapidly, and they're brittle. So our goal is to slow that process of withdrawal or stop it completely.
Okay, what draws it out? Just sitting around, that'd be one thing?
Sedentary lifestyle. A good example are the astronauts. When they're in a weightless state, they lose calcium rapidly from their bones. So sedentary lifestyle, not enough weight-bearing exercise is important. Another one that is little known is the area of protein in the diet.
Okay.
If we take in more protein than our body needs, then the body has to eliminate that protein from the body, and it eliminates it through the kidneys. As they're eliminating it, it takes calcium with the protein molecules, with the amino acids, and it actually takes that calcium out of the bank, draws it out of the bank from the bones.
Any other things we should avoid?
Some of the other things are phosphates. Phosphates are found in soda drinks. The animal products, meats, are high in phosphates, and they tend to rob calcium from the bones, as well as things like cigarette smoking. We know that doubles the rate of someone having a hip fracture from osteoporosis. Alcohol intake leads to calcium loss from the bones. And so in the area of getting calcium, the goal is to get as much calcium as you can, but without the protein. Okay. And there are calcium-rich foods that are high in calcium. A lot of the green leafy vegetables.
Green leafy vegetables, broccoli, kale, green beans.
Tofu. High in calcium, but low in protein.
We've been talking with Dr. Kevin Bryant from Wichita, Kansas. We've looked at some health concerns for older Americans. We've looked at natural remedies for those. We've looked at how we can avoid these things through proper medical care, also through proper lifestyle choices, but then in addition looking at natural remedies to, stop these things from happening or reverse them. We hope that today's program has been a blessing to you and that you have health that lasts for a lifetime.